The following short video is showing you a standard examination which all our venous patients are undergoing. First of all, the patient is coming to the assistant who is measuring the oxygen concentration in the blood of the toes. The oxygen concentration is an important information for us, showing us if there is any arterial problem. The next test is an infrared testing of the venous competence of the legs, showing us if there is any insufficient superficial or deep vein which is allowing the blood to flow back into the legs, which we call a reflux. Next is a standardized photo documentation of the findings before and later on during and after the treatment. Now the patient is ready to see me for a further examination by ultrasound. The next step of the examination after the patient has seen the assistant is now done by me. We are first having a so-called clinically look on the legs, that is just by looking at the legs and looking if there are any particular signs of venous insufficiency. I'm showing the great saphenous vein is running from the ankle to the groin. We will always see insufficiencies of the great saphenous vein just in the lower leg. On the back of the legs there is the small saphenous vein and its so-called thigh extension running up the calf and running over the thigh. Next step is a thermal image. Thermal imaging is able to show us veins, as you can see on the right picture here, that are insufficient but aren't visible because they are covered by skin and subcutaneous tissue. The next and most important step, and the examination can take up to 90 minutes now, is a very scrupulous ultrasound scan of both legs. You can see skin and subcutaneous tissue here in the upper part of the screen, the muscle tissue underneath, and you can detect a small superficial vein as a dark point on the upper third of the screen and two dark points in the muscle tissue showing an artery and a big inner vein. Now both legs are being examined by ultrasound scan from the groin to the ankle. During the examination, marks are made on the leg. The marks are then being measured so that the findings can be found again by ultrasound during the operation. All the findings are as well digitally as on paper saved and will be going together with the patient to theater. I'm now showing different types of catheters which are being introduced into the vein during the procedure and are destroying the venous wall from inside. This is a very tiny small steam catheter used for tinier veins. The first catheter you saw was a laser catheter. I'm demonstrating here how the vein is being injected with sterile steam. After the scrupulous examination, the treatment is then being explained to the patient, very detailed, and all questions are answered. Only a very well-informed patient will rely in the competence of the surgeon.